thank you for this opportunity to share some Danish experience in this very important area. I will give you a short introduction to the Danish journey to this single medication record, and afterwards Alice, my colleague, will focus on the rollout to the GPs, the more organizational dissemination task. So, to understand the role of Medcom, I think it's very important to understand the Danish healthcare sector and how it's organized. We have a very decentralized healthcare sector in Denmark. Of course, the government takes care of the legislation, but then we have 5 regions who runs the hospitals and also a public health insurance. We have 98 municipalities, and they are responsible for elderly care, social care, child care, prevention, and rehabilitation. And then we have the GPs and the pharmacists, of course, very important for this topic. And both the GPs and the pharmacists in Denmark are highly regulated from the public, but they are still private businesses. As a consequence of this very decentralized, some might say a fragmented healthcare sector, we also have a quite fragmented environment of IT solutions, because all these different stakeholders make their own decisions about IT solutions. But to support smooth patient pathways, in Denmark, we have this very strong tradition for digital cooperation between the different parts of healthcare. So, what is Medcom in this environment? We have for the last 27 years been disseminating data exchange between the GPs and the hospitals, municipalities, laboratories, and pharmacies. And has been quite successful in doing so, not as an authority, but as a non-profit cooperation between the different public and private authorities in healthcare. A very important partner for us is also all the IT vendors to Danish healthcare, because without them, it wouldn't be possible for us to obtain some integrated data exchange solutions to support good workflows for all the healthcare professionals. So the IT vendors to Danish healthcare has been very important for us too. We started out many years ago, as I said, and we started out basically by focusing on the GPs and the GPs' need for communication and data exchange with the surrounding healthcare sector. Because in Denmark, the GP has this gatekeeper role, so there's a lot of communication going through the GP to the more specialized part of the healthcare system. And of course, one very important partner for the GP2 is the pharmacy, and the prescription is, of course, and was and is still a very important communication need from the GP's point of view. Way before MedCom started out, back in the 60s, actually, we had this civil registration number being mandatory for all citizens in Denmark, and that's very useful when you want to exchange data between different IT systems. So we like the civil registration number a lot in Medcom. Back in the 70s, it became mandatory for hospitals to report patient data to a central register for administrative purposes. And again, that actually meant that the hospitals began establishing or buying IT systems. You cannot exchange data without IT systems, so a very important thing for us too in the 70s. And in the 80s, basically, the GPs and the pharmacists on their own initiative began to use IT in a small scale. So all these factors from the 60s and 70s and 80s was very important, a very important fundament for us starting out in the 90s with data exchange also between the GPs and the pharmacists. The GPs association and the different IT vendors to the GPs has been very important partners for MedCom for all the years, the 27 years. Together with the association and the IT vendors to the GPs, we have made a success based on close user involvement with a strong commitment to support an efficient workflow in general practice for the GPs. And as a result, the GPs are European champions in the use of information technology, measured by the use of patient record systems, data exchange with the rest of the healthcare sector, but also their digital communication with their patients. All very important for the prescription case too. Of course, before all this all these digital solutions, of course, the GPs in Denmark use papers too. And as you all know, that meant that only the GP and the patient, they had actually the knowledge about the prescription. No one else could see what your GP has prescribed. And in fact, you could visit another GP and ask for more medicine. GPs can still make paper prescriptions, but it's only allowed if the digital solution is not working. Moving from paper to e-prescriptions made the daily workflow more efficient for both the GPs and the pharmacy due to the reuse of data. Data was born in the patient record system and reused at the pharmacy for inventory management and information to the patient. Based on local pilot projects, Medcoms as such became a national success. And today, all hospitals, all GP clinics, all municipalities, and all pharmacies are connected in a national health net using Medcom standards for exchange of health data. More than 10 million e-messages are exchanged every month, and it's mandatory for all IT systems in Danish healthcare to use the Medcom standards. But it was not mandatory from the beginning. We made a lot of failures, trial and errors before we got a working system, and then afterwards it became mandatory. And the e-prescription was a very important part of this success, but it was based on, from the start, based on e-messaging from the GP to the pharmacy, point-to-point communication. In 2006, the vision of a real-time information about prescription was formulated, actually by a GP. In 2010, the shared medication record was introduced, and the 1st of September 2014, the e-prescription server was shut down for good and replaced by this shared medication prescription. And so my last slide before Alice takes over with more knowledge about this solution. But what is this shared medication record? What does it introduce? Basically, we moved from this e-messaging point-to-point to a data sharing solution. And this solution contains real-time information about the prescribed medicine for all patients in Denmark. It contains both information about prescribed medicine, but also vaccines. A little speciality, when a patient is hospitalized, it's actually not updated, but it's updated again when you are discharged from the hospital. You see the different players in this system. Of course, you have the role of a doctor, both at the GPs and at the hospitals. You have the pharmacy, you have the home care nurses, and then of course also the citizens. Both doctors and pharmacists can both read and write in this shared medication record. And citizens and home care, for them it's read only. A very important issue again is that this shared medication record is integrated with the local IT systems, the patient record systems, both in hospitals, at the GP and home care, and at the pharmacy too. And for the citizen, we have this public health portal, sundhed.dk or health.dk, but also a public medicine app where I as a citizen can follow my medication. And I think just as a disclaimer, Medcom does not own this solution. It's owned by the Danish Health Data Authority.
Good afternoon, everybody. I'm Alice Kristensen from Medcom. I'm a consultant and has been working with this shared medication record for about 12 years now. And I will tell you a little about the organization and participants in the shared medication record in Denmark, how the situation is today, and a little like Lars, what it was before and after we started with shared medication record. And of course, I will tell you something about how we did this rollout process to the GPs in Denmark and how we are keeping up the spirit, because you cannot just sleep and think it's working alone. You have to be on the fire all the time. So we will continue from here. Shared medication record, in Danish we call it Fælles Medicinkort, and we shortened it FMK. And I hope it's okay with you if I say FMK. It's much easier than saying shared medication record a lot of times. So FMK is the Danish shortening of shared medication record. And the FMK is a national service, and we have it to ensure better patient care and to minimize that medication errors occurs. And as Lars told you before, all health professionals and authorities in Denmark are obligated to use the service. You are only allowed to use the paper prescription if the FMK is down or the internet is not working. And we have access to patients' current medication in one national database. So all data about all citizens' medication in Denmark is in this one database. And if you are allowed to look into our medication data, you are looking into this database. And it's open 24/7, so both citizens and relevant health professionals have access to updated medical information in FMK. And also, as Lars told you, FMK is read-only for citizens, but you have the opportunity to do something, though. For example, if you want to mark a ordination private, you can do it. If you don't want all health professionals to see what kind of medicine you're taking, you can mark it private. But of course, the doctor can always open your medication record in case you are going to a hospital and unconscious. Yeah. So we have this national solution, FMK Online, and that is the solution that citizens can approach. And also if a GP doesn't has his own system, he can use FMK Online. But most GPs have their own system. And the organization behind FMK is called Sundhedsdatastyrelsen in Danish, SDS in short. And I think you are going to have these slides afterwards, so you can look up the internet site to read more about the organization. So approximately 25 private IT vendors have implemented FMK in their system, and that means that we have also approximately 25 different user interfaces. We do not decide how the interface is going to look like, if they are going to use green colors, red colors, or different kind of fonts. So that can cause some misunderstanding sometimes if different GPs are talking together about a patient and they have different systems and they do not understand each other when they are saying, but in the right corner you have this, and in the left corner you have that. But it's not the same in the interfaces, so it can cause some misunderstandings sometimes. In order to use FMK, you have to pass a test and certification, and this test is we are doing it together with SDS, and you cannot go online. You cannot use the system without being whitelisted and without passing this test. That's important. And the testing and certification is ongoing because we have new versions. And every time a new version is released, you have to do the test once again to make sure that everything is correct. Medication is very important, not to make any mistakes, to give wrong medication. So today the situation is that all hospitals in the 5 regions are using FMK. All the GP clinics are using FMK. About 98% of the specialist doctors are using FMK. All the municipalities, it means the home care systems, dentists are using FMK. In fact, they are not obligated to use FMK, but if a dentist is going to make a prescription, he has to do it the digital way, and that is FMK. So you can say he is obligated to use FMK anyway. And then all the pharmacies are using FMK, and some of our social institutions, centers for alcohol and substance abuse, they have also started to use FMK. They are not obligated to use it, but they do it in a large scale. So this little GP here in the left side of your screen, he's working before FMK. He was sitting in his little bubble, if you can say so, having all the medication almost as a secret in his own system, and no one would know what he was doing. Instead, now we have FMK, and every time the GP is making a prescription, is ordering some medicine to a citizen, everyone else can see what this citizen is taking. So that means he has to keep the system in order, because if you are not having order in your own system, your colleagues in the hospitals and pharmacies, nurse home care, they cannot use it. So it was tough in the beginning to share the secrets you had in your own little bubbles. So as I told you, all the data, the medicine data in Denmark is in one database. So if you are allowed to look into this database, you all see the same data. If a citizen, for instance, asks for more medication at another GP than he's normally going to, then the new GP can look up in FMK and see, but I'm sorry, yesterday you got the medication, your medicine from another doctor, so you cannot have it again today. So it's clear for all clinicians who are allowed to look into this FMK, what is happening and what kind of medicine the citizens are taking. So the role at Medcom in this FMK project, as Lars told you, we have a very good experience with working with the IT vendors. It is one of our basic tasks in Medcom. So our role there was to ensure that all the IT systems developed and implemented FMK in their systems. And as I told you before, we were doing tests and certifications. and then the rollout process, first at the GPs and the specialist doctors, then all 98 municipalities and dentists, and the last one who came on FMK system was the pharmacies. And of course, the focus on correct use and all the new terms and methods were also one of the tasks in this project. So how did we do it? In the beginning, about 10, 11 years ago, we invited all GPs and their staff to meetings after work hours, and we invited all GPs with the same system at different places in Denmark, and told them in general about FMK, the new system they were going to use, and the IT vendor demonstrated the solution, the way they had implemented it in the specific system. We had a lot of meetings. I was driving around Denmark for most of a year to give these meetings, but it was an exciting time. Of course, there were some challenges, some resistance. Some of the GPs and their staff were invited to these after working hours meetings before they got access to the system. That was not very good, because you forget all about it if you cannot go home and use it at once. It's like taking the driving license. You just don't learn to drive before you're sitting there. And then there were some questions about responsibility. Some GPs were frightened that they had the responsibility for all ordinations in FMK. That means if another doctor had made an ordination, was that also my responsibility? What if it was a wrong ordination? But GPs do not have more responsibility after FMK was introduced than before. But of course, if they discover something, an obvious mistake, they have to react, but they are not responsible for other doctors' ordinations in FMK. Then we had this problem with changing ordinations and prescriptions. In the beginning, it was a problem for doctors in hospitals to use the ordinations in FMK and to change them if they had to. They just deleted them and made some new. They discontinued them, and then when the patient got back to the GP observed that everything was changed from what he had done, and it was quite some big troubles at that time. But after we have had some new versions, FMK new versions, that problem is over, because it's now easier for all clinicians to use FMK. And again, the different interfaces I told you before, when we have 25 different systems with different interfaces, that can cause some troubles. And also, GPs in Denmark are self-employed, so you cannot force them to get education. You cannot force them to join these meetings. So some GPs just try and click around in the system to find out how it works, and it's not always the right way they do it. And finally, common terminology. It's so important to use the same words and concepts, so you know what you are talking about. When we are testing the systems, we are looking into that thing and telling them to use the same words and concepts in each system. This is just a little picture from our monitoring, where you have this little blue circle here, and the zeros means this clinic is not using FMK, and the one down here means they are using FMK. So that was the way we followed up to secure that every GP in Denmark started to use FMK, and every time we found a clinic with a zero, we called them or paid them a visit to help them getting started. And still we are using this statistics to follow up and to review that they use FMK as they are told to or have to. And then keeping up the good spirit and good work. We don't hear much complaints any longer about FMK in the beginning. Every time you have to do something new, you are maybe a little frightened and don't know how it works. But after now 10, 12 years with FMK, we nearly don't hear any complaints anymore. But of course, we have to develop all the times, and we have around FMK a big governance set up in the Danish health data security. We have a leading board, we have a clinician group, technical group, cross-sectorial group, and a statistics group, and we meet in these groups 3 to 4 times every year to keep this FMK running in a good way. Here in Medcom, we have a support group where supporters from the IT vendors are coming twice a year to talk about their experiences. What are they hearing from their customers? What kind of support are they giving? And then finally, we have end-to-end test where all IT vendors are coming 2 days every year and testing end-to-end to see how the data is flowing from one system to another and no mistakes are made. It's a very good course these 2 days, and they are not afraid to show their systems, the different IT vendors. That's very good. So the last slide here from me, lesson learned. It's a very big IT project to get all clinicians in Denmark to use the same system, and you need commitment from all parts to make it a success. And sometimes I would have liked the possibility to sanction someone when deadlines are exceeded. It's not funny when an IT vendor come and say we cannot release the new version until a year or so. Education is very important. I would also have loved to be able to force the GPs to come to education. That would have solved a lot of problems during the implementation. And then the understanding of the term shared, that is very important. You are not sitting in your little bubble any longer. You are sharing data with someone else. Yes, I think I will stop here. I talked a lot, I think. So thank you for listening.
Thank you very much, Alice.